Hey green belts, now it's time to open up the posterior chain. Okay, so remember what we're going to do is we're going to work a system called MSA. The M is myofascial release, foam roller, ball, something to dig into that tissue, get it warmed up. S is the stretch. So now you're done digging that thing around. Now we want to elongate that tissue, kind of clean it out a little bit. Once you're done with all the hard work, the A is activation. That's our whole goal. If you skip the A, the activation part, you've done all that hard work for nothing. It's a window to improve your mobility to then now open up that area that's weak. Okay, so first we're going to do the M part. We have Haley here on a foam roller. What we're going to do first is do the spine. So just put it between your shoulder blades. You can pick the butt up, kind of mobilize that spine. Okay, we've already kind of talked about this before in the white belt series, but you're just trying to warm up to get that spine to flex and extend a little bit. So like I said before, everyone's kind of typically hunched over, has an increased kyphotic curve, so the rolled shoulder, mid-back. We want to get that extension through here. Remember to work on your breathing too. If you come up, you breathe out. You open up, you breathe in. Okay? Then now what you're going to do is you're going to sit on it. We're wanting to work the hips. So remember on this one, cross the leg. Whatever leg you cross, that's the hip or side or glute you're going to work on. Okay? Now remember the foam rolling part is just the scan. You're trying to scan that tissue to find that trigger point and stop. And like Haley's doing, she's moving that knee up and down, trying to dig that knot out of there. Okay? Then the next side, of course, do the other side, but we're going to skip that part. Now we're going to do just a little bit on the hamstrings, just a little bit. Now personally, I'm going to show you how to, well, Haley's going to show you how to do this on a foam roller. Honestly, I don't really like it on the foam roller. I actually like to use a ball because it's a pretty deep muscle. It's hard to get that tissue to really open up with the foam roller. But she's going to show you real quick. Just put it in the back of the legs. And then you're just going to kind of pick yourself up and roll back and forth in the hamstring. Not rocket science. Now for those who do this and don't really feel anything, I'm going to show you an alternative. Take a foam roll, a yoga block, just to give it some height, and take a little ball. Okay, this is called an acouple ball. This thing's about 3.5 inches. All you're going to do is you're going to set it on top, just so it has some height to it. So Haley's going to put this underneath the hamstring. You're not really going to roll around too much on this. You're going to roll it till you find that spot, and then just kind of sit there. If you can deal with it, and you have enough arm strength, you can put your other leg on top of it just to add more weight. But it digs pretty deep in there, okay? And it's kind of hard to roll around, so just find that trigger point. Now, back to the foam roller. We're going to continue with that posterior chain. We're going to work your calves, gastroc, Achilles area, etc. So right now, Haley went ahead and did the hard one. Okay, now if it's too much for you and you just don't have the arm strength to do it, she's going to bend the knee, kind of put it on the side of the foam roller, and just do one leg at a time. Okay. Now, say you get to a spot, you're like, ooh, that one's tender. What you're going to do is you're going to gas pedal. Sit there, move that tissue around. Now also don't forget to kind of bring the leg in and roll, kind of get that inside part of the calf, and of course the outside. Now if you have a spot you're like, ooh, I really want to sit there and work on it, if you find that knot, you put the other leg on top of it, kind of like she did before, and then you can really feel that area. Now there again, if you want to torture yourself, get the little yoga block and the ball. You will really dig into that area. Okay? Now that's for the posterior chain. Now we're going to kind of tackle the hip flexors with this also, mainly just the quads. So what I'm going to have Haley do is go face down, and then just put it on. You're going to put it on your thigh. You're just going to roll that thigh. If you find that little knot, flex and extend that knee. Sit there and kind of dig that knot. It's typically right in the middle part of the thigh, especially if you're doing a lot of squats. And honestly, a lot of sitting sometimes. You want to kind of work a little bit higher up into the thigh area. Okay, so that is the myofascial release part of it, the M. Now it's time to do the stretching part. You will really dig into that area. Okay? Now, that's for the posterior chain. Now we're going to kind of tackle the hip flexors with this also, mainly just the quads. So what I'm going to have Haley do is go face down, and then just put it on. You're going to put it on your thigh. And there again, like we did again in the white belt video, you're just going to roll that thigh. If you find that little knot, flex and extend that knee. Sit there and kind of dig that knot. It's typically right in the middle part of the thigh. So next what we're going to do is the S, the stretching part. Now, what we're going to do is you attach a pretty thick band to something that's not going to move. Either a pole or a deadbolt door or something, okay? And we have the circular bands here. Haley put her leg through it, kind of put it right around the butt cheek area, and you're gonna take that leg that you put in the band on the ground. And you're gonna go into a lunge position. Okay, what you're gonna do first is you're gonna sit up nice and tall. I actually want you to kind of posterior pelvic tilt, so squeeze that glute if you can, and then you're actually going to flex your core. So the job of the hip flexor is, number one, is to flex the hip. Number two is to extend the lumbar spine or the lower back. So we don't want to arch the back. We want to do the complete opposite. We want to extend the hip and also flex the lumbar spine. So I always tell people, just kind of do like a mini crunch and hold it. Then I want you to let the band do its job and bring that hip flexor forward. Now, if you want a deeper stretch, then what you do is with the same leg you're stretching, take that arm and reach to the ceiling. Perfect, nice and tall. Squeeze that glute, try not to arch the back. And then what you're also going to do is lean the opposite direction. Good. Nice deep breaths. Typically about 3 deep breaths, you're pretty good with this one. Now what we're going to do is we're going to do a pretzel type position. We're going to add the thoracic spine into this. So with that same area, what I like to do is kind of Haley did is she grabbed the band to kind of steady her. And you're going to grab that hand to the foot, and then she's going to move this hand to kind of grab the thigh, and she's going to try to rotate her mid-back, but try to squeeze the glute and try not to arch the back. This is a huge stretch. Try to breathe this bad boy out. Okay, now for the activation part. Now, a lot of times people have a lack of pelvic stability, and so when they do their toe touch or their leg raise, they can't really achieve the range of motion they want, either because the tissue is tight, we've already worked on that, or the pelvis just doesn't have the stability there, so it's kind of like tilted forward, and then it's kind of pulling on the hamstring, so the range of motion is already going to be limited because the where it's attaching is moved further away. So we want to control what our lumbar spine and pelvis is doing. So we're going to assist this. So we have something attached to something that's not going to move. We have Haley grabbing it, and she's going to pull it down just a little bit. It's just here to activate the core. So when she raises her leg, her back doesn't move up and down. So now we're going to have Haley raise one leg up and lower it down, nice and slow. The whole thing is she should not have any back arching or any type of spinal movement because she's working hard to activate this core. And breathe behind the shield. So this is hard right here, and she still has to breathe. If not, she'll pass out while she's here, okay? Now, this is nice and challenging, which is great. If you feel, especially at the lower part, that your pelvis is coming up or it's kind of popping or doing something weird in this pelvic area, either don't go down as far or really, really work hard to breaking posture and position here.